Hi everybody, I'm Dr. Newman. I want to talk a little bit about breast reduction surgery and kind of something that comes up in conversation all the time when we talk about that, and that is insurability. And there are many cases where insurance will pay for breast reduction surgery, but the insurability of breast reduction really has to do with the fact that the insurance company needs to be convinced that the reason why you're having a breast reduction is medical rather than it being cosmetic. Well, what makes it medical? The insurance companies don't really look upon breast reduction as something that's treating the fact that your breasts are large and you just don't want them to be large. They're treating and paying for breast reduction because it's a treatment for neck pain, back pain, and shoulder pain. So for people who have long-standing pain in their neck and their upper back, breast reduction is sometimes looked upon as a treatment for that. But the insurance company has certain requirements. They want to know what things you've done to try to help yourself with neck pain, back pain, and shoulder pain. If the purpose of you having a breast reduction is as a treatment for your neck problems, they're going to want to know what else you've tried to do other than come to a plastic surgeon. They're going to want to know, have you gone to a chiropractor? Have you had a physical therapist look at your neck? Have you spoken to your doctor about it? Have you ever been prescribed any medicines for the pains that you have? Has anybody ever suggested certain exercises, postural changes, and things like that? They'll be very curious about other things that also show that you have issues or medical problems because your breasts are too large. Do you have grooving from your bra straps? I've seen patients even get sores from their bra strap because breasts are so heavy and their bra straps are kind of rubbing in all day. Frequently, patients get something called intertrigo, which is a fungal infection underneath their breast because the area is just always very humid. They would be interested in knowing what you've done to try to treat intertrigo if you have it. So there are many things that having large breasts may contribute to. The insurance company needs to know that your reason for having your breast reduction is not because you just want your breasts to be smaller, but really because you have a medical issue and breast reduction is being used to try to treat that medical issue. Now, the other thing that the insurance companies really need to be convinced about is that you're having enough of a breast reduction to make a difference. Naturally, if somebody's breasts are large and we remove 1 ounce of breast tissue from each breast, that's not going to help with your neck pain and back pain. Well, how about 2 ounces or 3 ounces or 5 ounces or 10 ounces? Where do we draw the line? It used to be very straightforward. It used to be the requirement was 500 gram, a little bit more than 1 pound of breast tissue on each side of a reduction. That was kind of the cutoff, but didn't make much sense because somebody who's 6'1" has a very different size breast that would make a difference for her body and her posture than somebody who's 4'10". We now have a little bit more precise way of measuring for that. It's something that's called the Schnur scale after Dr. Schnur. And that scale basically looks at your height and your weight. We use your height and your weight to calculate your body surface area, but it's a measurement based upon your height and your weight. And based upon that, we can look at a table, and that chart will show us what the typical insurance company's requirement would be for that cutoff between it being a cosmetic procedure and it being a reconstructive or a medically necessary procedure. The insurance company has their cutoff. The Schnur scale is typically what they'll use for it. There'll be a link below for the Schnur scale on my website to give you an idea based upon your height and your weight, what the Schnur scale says your insurance company will probably look for as far as the amount of tissue needing to be removed from your breasts in order for it to be insurable. Each insurance company works differently. Not all of them adhere to that scale exactly, but that's a good guideline for how much tissue needs to be removed from your breast before the insurance company would consider it to be a procedure that could be used as a treatment for neck pain and back pain and shoulder pain, rather than it just simply being a cosmetic operation. So I hope this all helps. This is a big conversation when it comes to breast reduction, and it's something that we talk about with all of the patients. I hope this clarifies it a little bit.